Good morning, Alex and friends. I'm Grace. Today is Tuesday, August 18th, 2026, and you're listening to Alex's News. In Riverside today, we are seeing quite a hot day with a high of 97.1 degrees and a low of 70.2, so please make sure to find some shade and keep hydrated if you have plans to be outdoors this afternoon. On the show, we are diving into the diplomatic efforts as the United States and Canada work to prevent a trade war from escalating. We will also explore the implications of HealthNet's decision to cut back on assisted living benefits for thousands of Californians across the state. We have several other reports covering the latest events from around the globe as well. All of this and more on Alex's News, so stay with us. Good morning. This morning we're watching a trade showdown between the United States and Canada, with a midnight deadline fast approaching. Our reporter Ethan has been tracking it all. Ethan, what's the headline here?
Good morning, Grace. As of today, August 18th, 2026, the two countries are locked in last-minute high-stakes talks. President Donald Trump has announced a plan to slap 50% tariffs on roughly $20 billion worth of Canadian goods. That's about 5% of Canada's exports to the U.S. And the clock is ticking, because the deadline is set for 12:01 a.m. on Wednesday, August 19th. That's tomorrow.
So essentially the middle of tonight. What legal authority is the White House using to do this?
This is one of the most unusual parts of the story. According to the Associated Press, NBC News, and The Independent, the Trump administration is invoking Section 338 of the Tariff Act of 1930. That's a 96-year-old law tied to the notorious Smoot-Hawley tariffs from the Great Depression. It lets the president penalize countries that discriminate against U.S. commerce. And here's the striking detail. Grace, no president has ever invoked Section 338 before.
Never? That's remarkable. Why reach for such an old, untested law?
It gives the administration some real advantages. Unlike Section 301 sanctions, Section 338 tariffs require no formal investigation. And they have no predetermined expiration date, so they could stay in place indefinitely. The White House says it's responding to what it calls Canada's, quote, discriminatory treatment, end quote, of American exports. They're pointing specifically to automobiles, alcohol, and dairy.
And which Canadian products would actually get hit by these tariffs?
It's a surprisingly wide range. The targeted goods include hockey sticks, tongue depressors, and clothing, along with wine, dairy products, and building materials like cement and plywood. So everyday items, really. But NBC News notes that some big categories are excluded. Energy products, potash, fish, and critical minerals are all left off the list, which tells you something about where both sides feel most vulnerable.
Let's turn to the talks themselves. How are the Canadians describing where things stand?
Canadian Prime Minister Mark Carney has called the negotiations, quote, very intense and delicate, end quote. He's made clear he thinks this is not the time for public discussion of specifics, and these talks are happening at the very top. According to a spokesperson for the Prime Minister, Carney spoke directly with President Trump by telephone on Monday afternoon, so this isn't just staff level. The leaders themselves are involved.
What about the negotiators on the ground in Washington?
Canada's Minister for U.S. Trade, Dominic LeBlanc, and Chief Trade Negotiator Janice Charette have been holding what they describe as detailed technical discussions. On Monday afternoon, the two of them met for about 1 hour and 45 minutes with U.S. Trade Representative Jamieson Greer and Commerce Secretary Howard Lutnick. Afterward, LeBlanc said their, quote, job is not yet done, end quote. Greer, for his part, declined to comment.
When you hear language like that, does it sound like they're close to a deal or far apart?
It's hard to read, but there are signs both sides want a way out. Former U.S. trade official Ryan Majerus, cited by the Associated Press and The Independent, suggests both nations are looking for an, quote, off-ramp, end quote. That's important, because it means neither side is necessarily eager for a full-blown trade war. The tariffs, in that framing, are leverage more than a final destination.
So what exactly is the U.S. trying to get out of this?
The U.S. is reportedly using these tariffs to push Ottawa towards several concessions. One is increased Canadian purchases of U.S. military equipment, specifically F-35 fighters. Another is Canadian participation in the, quote, Golden Dome, end quote, missile defense system. And a third is greater U.S. access to Canada's critical minerals, which would help reduce American reliance on China. So this goes well beyond trade. It touches defense and strategic supply chains.
And on the flip side, what does Canada want in return?
Canada is seeking relief from existing U.S. tariffs on steel, aluminum, and softwood lumber. Now, the U.S. maintains softwood lumber is unfairly subsidized by the Canadian government, so that's a long-standing sore point. Essentially, each side is holding something the other wants. That's what makes an off-ramp possible, but it also makes the talks genuinely delicate, just as Carney said.
Ethan, there's also been a lot of pointed rhetoric from the president about Canada. How is that shaping the mood?
It really is coloring everything. The Associated Press and The Independent report that Trump has made inflammatory remarks about annexing Canada as America's 51st state. That's landed hard in Canada. In fact, it's fueled a petition with nearly 218,000 signatures, calling for the expulsion of U.S. Ambassador Pete Hoekstra, accusing him of, quote, normalizing, end quote, that kind of rhetoric. So this isn't happening in a calm environment. There's real friction.
Let's talk dollars. Just how economically intertwined are these two countries?
Deeply. In 2025, Canada was the third largest source of U.S. imports, with more than $380 billion in goods crossing the border. And nearly 72% of Canadian exports go to the U.S. So Canada is enormously dependent on that relationship. That imbalance is part of why these negotiations carry such weight for Ottawa.
Who ends up actually paying for tariffs like these?
That's the part a lot of people misunderstand, Grace. Experts warn these tariffs would likely be paid by U.S. importers and then passed along to American consumers, and that's happening at a sensitive moment. U.S. consumer prices are already up 3.4% over the last year. American voters are frustrated by the cost of living. So some observers think the Trump administration may be wary of the political fallout, especially with the November midterm elections coming up.
So the politics cut both ways here. Now, there's also a bigger trade agreement in the background, isn't there?
There is. All of this is tangled up with the renegotiation of the U.S.-Mexico-Canada agreement, the USMCA. Prime Minister Carney has called these threatened duties a, quote, direct violation, end quote, of that pact. And there's a real question about whether you can even renegotiate a deal while you're fighting over tariffs. Christopher Gunderman of the Center for Strategic and International Studies put it plainly, the agreement needs renegotiation, but it can't be done effectively in the middle of a massive trade war.
That's a tough position for Carney. What are the risks for him politically?
They're significant. Daniel Beland of McGill University warns that if the Carney government appears to, quote, cave, end quote, to U.S. demands without getting meaningful concessions in return, it could leave Canada vulnerable to further geopolitical bullying. So Carney is walking a tightrope. Give too much and he looks weak at home. Give too little and the tariffs take effect tomorrow. That's the bind he's in tonight.
With the deadline just hours away, what should we all be watching for next?
The key moment is that 12:01 a.m. deadline on Wednesday tomorrow. Watch whether the two sides announce any kind of extension or framework before then, because that off-ramp Ryan Madras described is still on the table. If nothing comes together, those 50% tariffs hit roughly $20 billion in Canadian goods. And remember, because this uses Section 338, there's no built-in expiration, so they wouldn't simply fade away on their own.
And if they do take effect, how quickly might people notice?
It wouldn't be instant, but it would ripple. Since U.S. importers pay first and pass costs along, you'd eventually see it in prices on things like wine, dairy, and building materials, such as cement and plywood. That matters for anyone renovating a home or shopping at the grocery store. Layer that on top of prices already up 3.4%, and you can see why this is as much a kitchen table story as a diplomatic one.
Ethan, thank you. Really clear reporting on a story with a deadline that's almost here.
My pleasure, Grace. I'll keep watching those talks overnight and bring you the latest.
That's Ethan, tracking the U.S.-Canada trade standoff with that midnight deadline now just hours away. Stay with us. Welcome back. Our next story tonight hits close to home for thousands of California families. It's about a major insurer pulling the plug on assisted living benefits. Chloe's been following this one closely. Chloe, walk us through what's happening.
Thanks, Grace. So as of today, August 18th, HealthNet, one of California's big Medi-Cal insurers, is moving to cancel assisted living benefits for about 3,500 patients. That's supposed to happen by the end of this year. According to reporting from CalMatters, the majority of these folks are elderly, and many of them are living with cognitive impairments like dementia.
That's a lot of vulnerable people. What exactly do these benefits cover?
They're part of a program called CAL-AIM. That's California's effort to improve Medi-Cal and cut costs by stabilizing high-need patients who keep ending up in emergency rooms. The assisted living piece covers most of the 24-hour service costs at memory care facilities, boarding care homes, and larger group settings. What it doesn't cover is room and board, so residents still pay for that part themselves. Think of it as help with the care, not the rent.
And I understand this is an optional benefit. What does that mean for patients?
Right, that's a key detail. Assisted living support is an optional Medi-Cal benefit, so insurance plans choose whether to opt in. And here's the catch. They have to decide every single year whether to keep offering it. So a benefit families rely on can basically evaporate on an annual basis. That's exactly what we're watching unfold with HealthNet right now.
Why did the state create this benefit in the first place?
It was meant to take pressure off a separate state-managed assisted living program for low-income patients. That program is overwhelmed. It has an 18,000-person cap, and the wait list runs 3 to 4 years. So the idea was to give people another path instead of leaving them stuck in that line. Now advocates worry these patients could get funneled right back into that backlog.
How wide is the footprint here? Which parts of the state are affected?
HealthNet runs Medi-Cal plans across 10 California counties. Those are Amador, Calaveras, Fresno, Inyo, Los Angeles, Mono, Sacramento, San Joaquin, Stanislaus, and Tulare. And it's not just HealthNet directly. 2 of its contractors, Calviva Health and the Community Health Plan of Imperial Valley, have also told the state they intend to discontinue these benefits. So the ripple effect reaches even further than that main list of counties.
So what's HealthNet's explanation for cutting all of this?
The company laid it out in an unsigned statement and a termination notice sent to the Department of Healthcare Services. Their first argument is financial. They claim the program didn't actually improve care outcomes, saying they saw no significant drop in hospitalizations or emergency room visits. Basically, they argue it wasn't delivering the results it promised. So from their view, the spending wasn't paying off.
You said that was their first argument. What else are they pointing to?
Their second point is about who's using the benefit. HealthNet says more members are moving straight from their own homes into assisted living rather than transitioning out of nursing homes. And they argue that trend actually drives costs up instead of creating the savings the state intended. In other words, people they didn't expect started signing up. That, they say, broke the math behind the program.
And there's a regulatory angle too, right?
There is. HealthNet is also pointing the finger at regulators. The insurer says the state changed guidelines that had previously let HealthNet limit those community transitions, and they claim that shift threatened the program's integrity and its long-term viability. So essentially they're saying, the rules changed on us. Whether regulators agree is a very different question, and we'll get to their response.
Before we do, let's talk money. What are families actually facing here?
The numbers are pretty stark, Grace. CalMatters reports that assisted living facilities typically run between $5,000 and $7,000 a month, and nursing homes can climb past $10,000 monthly. So for families already stretched thin, losing this benefit isn't a minor inconvenience. It can mean the difference between keeping a loved one in care and having nowhere to turn.
Have you heard directly from any of these families?
Yes, and their stories are troubling. Jennifer Horcasitas-Glenn told CalMatters she didn't even hear about the changes from the insurer. She learned about it from a third-party provider. She also says HealthNet sent a letter claiming her mother-in-law's memory care approval would be revoked a month early and, quote, at the request of the provider, end quote. But here's the twist. The provider denied ever making that request.
That's a serious accusation. Was hers the only case?
No, there was another one. Matt Johnstone says he got a phone call telling him his 89-year-old father's board and care benefit was being eliminated. That's in North Hollywood, and it costs roughly $6,000 a month. So you've got families getting this life-altering news through phone calls and third parties, not clear official notices. Advocates describe the whole communication process as chaotic.
Now there's also confusion about when these services actually stop. What's going on there?
This is one of the messiest parts. HealthNet told some of its major contractors that services would terminate on October 7th, that's this October. But state regulators and advocates, including Hagar Dickman of Justice and Aging, insist the plan is legally obligated to keep providing services through December 31st, the end of this year. HealthNet's counter is that members will get care through what they call their individual authorization date, so depending on who you ask, the deadline shifts by months.
And that gap has real consequences for people, doesn't it?
It really does. Pauline Shatara of California Advocates for Nursing Home Reform says some assisted living facilities have already confirmed that residents were dropped off at emergency rooms. Let that sink in. Elderly patients being left at ERs. And Jonathan Istran of Libertana suggested HealthNet simply lacks the infrastructure to pay facilities directly as these contracts expire. So even the mechanics of winding this down appear to be breaking down.
So what are state regulators saying about all of this?
The Department of Healthcare Services says the current patient protections are adequate. In an emailed statement, they noted that members can file grievances, appeal decisions, and access alternative services. And they say they're in communication with HealthNet to ensure continuity of care. So officially, the state's message is, there are safeguards in place, and we're on it.
But advocates aren't buying that, are they?
No, they're pushing back hard. Senior advocates argue those protections just aren't enough to stop patients from becoming unhoused or getting bounced between hospitals and skilled nursing facilities. Hagar Dickman of Justice and Aging put it bluntly. She summarized HealthNet's position by saying it's essentially that it's less costly to offer no services than to offer some. That's a pretty damning way to frame it.
So where does this leave those 3,500 patients right now?
In a very uncertain place, honestly. They're caught between an insurer that says it's done, a state that says protections exist, and advocates warning those protections won't hold. The clock is ticking toward that disputed October 7th date and the firmer December 31st deadline. Families are trying to figure out care plans and costs in real time. And with dementia patients involved, every week of confusion carries real risk.
What should families in those 10 counties be watching for next?
I'd watch two things closely. First, whether the state forces HealthNet to honor that December 31st obligation, because that timeline dispute affects thousands. And second, whether Calviva Health and the Community Health Plan of Imperial Valley follow through on dropping the benefit too. If they do, the number of affected patients could grow well beyond 3,500. Families should also document every notice they receive and file appeals quickly.
Really important reporting on a story that affects so many vulnerable Californians. Chloe, thank you for breaking it all down for us.
Happy to, Grace, and we'll keep following it as those deadlines approach.
That's going to do it for us tonight. Thanks for spending part of your morning with us. We'll see you back here tomorrow. Here are some other headlines. Turning to the tech world, it looks like Meta is about to face some serious scrutiny. A $1 trillion trial is set to kick off this Tuesday, August 18, 2026, in a federal court in Oakland, California. Attorneys general from 29 states are teaming up to take the social media giant to task, so we will see if the company can keep its feed clean or if it is about to get blocked by the legal system. Moving over to international news, we are continuing to track the aftermath of the devastating earthquake in Indonesia. The ground has finally stopped shaking, but the heartbreak remains. Reports confirm a death toll of 47 people and 157 houses damaged. It is a sobering reminder of how quickly the earth can pull the rug out from under us. In global health, the United Nations is sounding the alarm on Sustainable Development Goal 3. While they are striving for good health and well-being, there has been a significant drop in childhood vaccination rates. The organization blames the COVID-19 pandemic and other global crises for this dip, noting that we must get these numbers back on track to ensure our children are not left vulnerable. Back home in the capital, there is some high-stakes musical chairs happening with the FBI. A federal judge has just blocked the Trump administration's attempt to house the Bureau's new headquarters at the Ronald Reagan Building in Washington, D.C. This ruling clears the path for a move to Greenbelt, Maryland, a site picked by the Biden administration back in 2023. FBI Director Kash Patel had pushed for the D.C. location last summer, but Maryland fought back with a lawsuit. Attorney General Anthony Brown claims the administration tried to illegally divert over $300 million in funding already approved by Congress. Prince George's County Executive Aisha Braveboy says the Greenbelt project is a $4 billion investment that would bring over 7,500 jobs to the area. It looks like the FBI will be moving its operations out of the city and into the greenery. And finally, some drama on the hardwood. There is a bit of a family feud brewing with the Los Angeles Lakers. We are keeping a close eye on whether Jeannie Buss is contesting a plan by her siblings to sell their minority stake in the team to a group involving Kushner and Iger. It seems the Buss family is playing a high-stakes game of keep away with the team's ownership. We will see who gets the final shot in this power struggle. That's all we have for now. Today's episode was made by Alexander King with Claude Opus 4.8, Gemini Pro 3.1, Gemini Flash 3, and Google Cloud Text-to-Speech. I hope you have a great day. I'll see you tomorrow, Alex.